Hi, I'm Dr. Brennan Glacken, and I'm the owner at Glacken Physiotherapy, LLC. The purpose of this discussion is to talk about temporomandibular joint dysfunction and how physical therapists can help with that. I get asked a handful of times what physical therapists really do for TMJ dysfunction, so I thought a brief PowerPoint presentation would help. It's not meant to be extensive, it's just meant to introduce you to a couple things. And then if you have a couple more questions, feel free to reach out and we'll talk about how to do that at the end of the presentation. I decided to include this pup here not only because I'm a huge dog fan, but because his masseters are humongous, which makes for a very interesting discussion when it comes to TMJ and TMJ dysfunction. So causes of TMJ dysfunction, I typically, very simplistically, put into two roles. That's the dentist role and the physical therapist role. The dentist role tends to focus on more structural pathology, whether it's the teeth, the mandibular alignment, contact points, things of that nature. Now, physical therapist role is a little bit different. They tend to focus a little bit more on the muscles. They focus on the connective tissue. They focus on the nerves, whether it's the trigeminal nerve or the facial nerve that's problematic, in order to get some kind of relief. I tend to focus on breaking these musculoskeletal dysfunctions into layers. And this is how I typically do it. I go from superficial to deep, always starting with the connective tissue, and then moving to more deep fibrotic structures like the joint capsule. In this particular case, when we're discussing the face, we have the superficial fascia of the face, the muscles of facial expression, the muscles of mastication, and then finally the TMJ capsule, which can all be dysfunctional and contribute to pain. Now, the muscles of facial expression and superficial fascia are extremely underrated, in my opinion, when it comes to TMJ dysfunction. Any condition that involves changing the jaw in some way, whether it's braces or mandibular advancement surgery or trauma to the jaw, can affect these muscles in a significant way. Not only that, but scarring, facial scarring, can also play a role in dysfunction in these particular layers, but it of course depends on the depth of the scar. Now, the muscles of mastication tend to get a lot of my attention when it comes to TMJ rehabilitation. The majority of that is because they tend to be dysfunctional. They tend to have an overactivation on one side and an underactivation on the other side. But big area of focus definitely involves the masseter, temporalis, medial pterygoid, and the inferior portion of lateral pterygoid if we're talking about opening restrictions due to closure tightness, or the lateral pterygoid and digastric, making sure that they're firing correctly when the jaw is opening. An area that people tend to neglect when it comes to TMJ physical therapy is the hyoid muscles, and that involves the superior hyoid muscles above the hyoid bone and the inferior hyoid muscles. If there's a history of cervical surgery, that becomes even more relevant and more important. The final layer that we're getting to is the capsule. Now, the TMJ capsule is very similar to a lot of capsules in the body, where there is a fibrotic structure that's bringing two bones together. In this particular case, there of course is a disc in between these two bones, but the capsule is very similar. I always describe a capsule as a finger trap toy that I used to play with as a kid. We bring these fingers together within this woven type of structure, and then it becomes very difficult to separate them. And the capsule does something very similar. It prevents the mandibular bone from separating from the temporal bone. When this particular structure is getting too irritated, or it becomes fibrotic, or it gets inflamed, that ability for those two bones to separate becomes impaired, and that's when mobilizations can be effective. Now, this, of course, is a very brief summary of what we do for TMJ dysfunction, but it's a start. If you're interested in learning more, feel free to reach out. I have my personal cell phone number here. That's 908-328-3074, or you can reach me via email, and that's at brendan@glackenpt.com. You may also recognize this name. This is Kara. She reached out to a handful of you before this presentation, but you may also receive emails from her as well. That's kara@glackenpt.com. If you had somebody in mind already, somebody that you know is struggling with TMJ dysfunction, and you'd like to try to see if it's a good fit, I'm happy to perform an evaluation and send any information that you would like from the evaluation. Just include a contact name and a fax number, and I'm happy to do so. Thank you so much for taking the time to watch this presentation, and I look forward to talking with you soon. Take care.